An FDA advisory panel meets tomorrow to discuss whether the agency should authorize a third dose of the Pfizer vaccine. U.S. health officials say boosters are needed because of the vaccine's protection waning over time. But one Newnan doctor has doubts about that. The Fox Medical team's Beth Galvin talked to him about why.
Family practice Dr. Cecil Bennett has spent months trying to convince his patients to get the COVID-19 vaccine. But he says he's not convinced those same patients will need to come back for booster shots anytime soon.
It's been months since you had your second dose of the COVID-19 vaccine, so is it time for a booster shot?
Every day, my patients are asking me about boosters, especially my seniors.
Dr. Cecil Bennett, a family practice physician in Newnan, says he's been telling his patients they do not need a third shot unless they have a compromised immune system.
But what I'm finding is that I have seniors that have already gotten boosters and they do not meet criteria. And that worries me a little bit.
Because the question about whether all Americans need boosters is still being hotly debated. While there is growing data that the vaccine's protection wanes over time, the shots remain highly effective at preventing severe infection and death, even against the Delta variant. And Dr. Bennett says he routinely checks his patients' antibody levels, or titer levels, which he says for the most part remain really high.
And my concern, again, is giving a third dose to patients who do not need a third dose when I can objectively measure their antibody levels and say, but they don't need a third dose.
The Biden administration hopes to roll out booster shots as soon as next week if the FDA and CDC greenlight third doses of the Pfizer-BioNTech vaccine. The idea would be to give the boosters about 8 months after the second dose of the vaccine. But that's a timeline that Dr. Bennett says feels really arbitrary.
Again, these things can be measured by antibody levels. It's not a surprise. It's not a mystery. So I need full clarification, and it's unlikely that I'm going to offer boosters to any of my patients who are well above the titer cutoff. Because the sooner you give a booster, the sooner you have to give another booster.
And Dr. Bennett says while these vaccines are safe and effective, they are not without side effects.
I have patients that had side effects weeks after their second dose, and they were willing to live with that for what they were getting in terms of protection. Now I'm going to give them a third dose, which they may not need, to harm them again for another 2 to 3 weeks unnecessarily. I'm not going to do that.
If the FDA authorizes a third dose of the Pfizer-BioNTech vaccine, a CDC expert panel will meet to decide who should get those third doses. But it is not clear if the U.S. will move forward with the plan to offer booster shots to everyone. For your Fox Medical team, I'm Beth Galvin.